Hello, my name is Tirushan Wimaladas, and I am going to be talking to you about real life ethics in ambulance services. So, the case study which I decided to do was the refusal of treatment when paramedics try to perform interventions on patients. Um, I have found a very good article which reflects this. The case study is a study from a perspective of medical ethics, refusal or treatment in an ambulance. Before I go on to talking about how paramedics are able to overcome situations like this, I want to first go back to talking about what ethics are. So, overall, the idea of ethics is a branch of philosophy which is utilized to study the ideal human behavior and the ways that humans should be. So it is almost like a systematic approach. So for us to be able to understand, analyze, and distinguish matters of right and wrong. As described by Kirich and Lowe in a 2009 piece, ethics has multiple definitions where they have the concerns of how human beings should act in certain situations. Um, there's they have to consider what kind of life is best for the person, so for them to live their full potential. It also wants to examine what we should do rather than what we should actually be doing. Um, it also talks about the dilemmas, people, values, views, and experiences which affect a person's ethics. So, overall, it's pretty much stating that the way we should have a certain way that we have to act in society if we follow these ethics. The reason that ethics is very important in the paramedicine field is because paramedics have to aim to give the same quality of treatment for all patients and so that patients do not get treated differently. The next part is going to discuss the guides that paramedics utilize to make ethical decisions. So, in Victoria, there are many ambulance services which provide care and aid for patients. So, AMS Victoria is a ambulance service which provides emergency care for patients which require it. St John's Ambulance Service is both can both be an emergency and non-emergency service. So it provides first aid for great like big events, but it can also provide transport for people that might want to go to the doctor or the hospital. And that's the same with Royal Flying Doctor Service and National Patient Transport Service. So both those services are both non-emergency services which provide transport for patients from hospital to nursing homes or nursing homes to hospitals or doctors or anything like that which requires medical care. So in the ambulance field, there is also many ethical issues which are commonly faced, and some of these could include ceasing of treatment. So when in emergency care, sometimes the chance of survival is very low or there's no chance of survival, and the paramedic has to determine whether they should continue to with treatment or just cease it. Another issue is withholding information from patient or their family. So there might be instances where paramedics know that the patient isn't going to make it, and they don't know whether they want to tell the family or wait till later when it's the right time. And one final ethical issue which is faced by a lot of paramedics is refusing to transfer patients who are quite obese. This is due to OH&S standards. So paramedics don't want to hurt themselves or want their partners to be hurt because of lifting and moving a patient that is quite overweight. So now I'm just going to give a brief explanation of what normally provides guidance about ethical practice, and I'm going to be talking about two main ones. So the Ambulance Victoria Service and Paramedics Australasia. So both these have a code of conduct where Paramedics Australasia is an overall code of conduct for all paramedics or for all services. This includes integrity, respect, responsibility, accountability, competence, consent for patient care, and confidentiality. For Ambulance Victoria, they also have their own code of conduct. The reason they have this is so that they can have values which paramedics in the ambulance service must follow. This includes being respectful, working together, being accountable, communicate openly, and drive for innovation. So now we are going to move on to the case study. So it is a case from the perspective of medical ethics, refusal of treatment in an ambulance. And what happened is on Friday the 26th of September 2008, on the intercity highway in Turkey, there was a car accident. Bystanders called 112, which is the emergency hotline service. There was only one injured patient, and the patient, when ambulance services came, the patient states that he feels a severe stomach ache, which he can feel in his back. Originally, when they checked his blood pressure, it was 100/60, which is actually adequate. But after 5 minutes, it went down to 80/50, which becomes a bit more concerning. So the ambulance doctor suspects that there is some sort of intra-abdominal bleeding. The ambulance service wanted to help this patient, so what they wanted to do was give an intravenous serum. And during the whole treatment, the patient was quiet until this moment when the patient stated that it was a month of Ramadan and that the patient was fasting. And the patient declined treatment because it will break the fast. So, as described by NASA in a 2010 piece, he explains how Ramadan is a holy month where during dusk till dawn there is no eating or no drinking of any sort of liquid. So, the parties involved in this case scenario are the Islamic patient and the emergency doctor. So now I'm going to move on to the relevant principles and theories which are evident in this case. So when we're looking into the Muslim patient's perspective, this patient is clearly following the deontological ethics, where Porter states in 2014 that it is a set of rules that must be followed, and the patient is clearly following the rules of Ramadan, where it states that you're not allowed to eat or drink during the day. Because of this, the ambulance doctor has to take into consideration the religious principle that arises because of this issue. So, the ambulance doctor has to take into consideration the patient's beliefs, but there's also a matter of a legal aspect. If the ambulance doctor decides to give treatment even though the patient refuses, what will happen to the ambulance doctor? Another thing is that the ambulance doctor also follows deontological ethics. The reason for this is because the ambulance doctor has their own code of conduct where the patient has the right to refuse treatment, so the ambulance doctor must refuse treatment. So going back to the ethical issue, a cannula, which is a plastic device which is used for flexible venous access, was attached, but no fluid was administered. The ambulance doctor respected the patient's wishes and did not give the serum. The patient did not lose any conscious before reaching the hospital and was delivered fully conscious. In a situation like this, there needs to be a special course for paramedics where they can have training for ethical decision making. Maybe it can be done in university education levels also. Not only that, but they also need to develop or include in the current code of conduct, code of ethics, a section for how to treat patients who have religious beliefs. So that concludes my presentation. Thank you for listening.